If you or someone you love is taking a blood pressure medication right now, whether it's Amlodipine, Losartan, or Lisinopril, please do not scroll past this video, because what I'm about to share with you in the next few minutes could genuinely change how you feel every single day. And most doctors simply don't have time to tell you these things during a 10-minute appointment. So today, I'm going to sit down with you and talk about this like a real conversation. No confusing medical jargon, no scary terms, just honest, clear, caring information that every senior in America deserves to know. Now, let me start with something that might surprise you. Millions of Americans over the age of 50 are taking one of these 3 medications every single day. And for most of them, the medication is doing exactly what it's supposed to do, helping keep that blood pressure number in a safer range. That part is wonderful. But here's what many people don't realize, and this is really important. Taking that pill is only one piece of the puzzle. There's so much happening inside your body that the medication alone cannot fully address. And when people don't know about those other pieces, they end up feeling tired, dizzy, confused, or just not quite right, and they can't figure out why. Does that sound familiar? Maybe that's even why you clicked on this video today. So let's talk about this together, step by step, in plain, simple language. I promise you, by the end of this video, you are going to understand your own body so much better. First, let me explain what's actually going on when your blood pressure is high. Think of your blood vessels like a garden hose. When the water pressure inside that hose gets too strong, it starts to strain the hose itself. Over time, that constant pressure can cause tiny little cracks and damage on the inside walls of the hose. Now replace that hose with your arteries, the blood vessels carrying blood to your heart, your brain, your kidneys, and you start to understand why high blood pressure is called the silent killer. It causes damage quietly, slowly, over months and years, and most people feel nothing unusual until something serious happens. That's what makes it so dangerous. And that's exactly why so many seniors are prescribed medications like Amlodipine, Losartan, or Lisinopril to reduce that pressure and protect those vital organs. But wait, here's where it gets really important, and this is the part most people miss completely. These medications work in very different ways inside your body. Amlodipine, for example, is what doctors call a calcium channel blocker. What that means in simple terms is that it helps relax and widen your blood vessels so the blood can flow more easily, kind of like loosening a tight pipe. Losartan belongs to a group called ARBs, angiotensin receptor blockers, which work by blocking a chemical signal in your body that would normally cause your blood vessels to tighten. And Lisinopril is an ACE inhibitor, which works by reducing the production of that same tightening chemical in the first place. 3 different approaches, all aimed at the same goal, and knowing which one you're taking actually matters, because each one has its own set of things your body might experience while adjusting to it. Now, here is something that very few seniors are told. When you first start taking any of these medications, or even when your doctor changes your dose, your body goes through an adjustment period. And during that time, you might notice things that seem unrelated, little signs that your body is responding and adapting. Most people ignore these signs, and sometimes ignoring them is perfectly fine, but sometimes those little signs are your body quietly asking for attention. Let me walk you through some of the most common things people experience, and I really want you to listen carefully here, because these are things that happen every day to real people who take these medications, yet so many of them never connect the dots. One of the most common things, especially with Amlodipine, is swelling in the ankles or feet. You might notice your shoes feeling tighter at the end of the day, or a puffiness around your ankles that wasn't there before. This happens because the medication relaxes the blood vessels, and sometimes fluid can shift into the surrounding tissue. It's not dangerous for most people, but it can be uncomfortable. And many seniors just assume it's part of getting old without realizing it might be connected to their medication. Another thing, and this one is really common with Lisinopril, is a dry, nagging cough that just doesn't go away. People go to their doctor thinking they have allergies or maybe a cold that won't leave. But that persistent dry cough in the back of the throat, that tickle that makes you clear your throat constantly, is actually a known response that some people have to ACE inhibitors like Lisinopril. It's not dangerous, but it can be really bothersome. And again, most people don't connect it to the medication they've been taking for months. Then there's dizziness. This is a big one, and I want to talk about it carefully because it matters a lot for safety, especially for anyone over 60. When blood pressure drops, which is what these medications are designed to do, sometimes it drops a little too much, a little too quickly, especially when you stand up after sitting or lying down. You might feel a sudden rush to the head or a lightheadedness that makes you grab onto something. Doctors have a name for this: orthostatic hypotension. But you don't need to remember that term. What you need to remember is this: if you feel dizzy when you stand up, don't rush it. Take a moment. Sit on the edge of your bed before you stand. Hold onto something solid, because that dizziness can lead to a fall, and for many seniors, a fall can be far more serious than the blood pressure issue itself. Most people don't realize this, but dizziness and falls are one of the most overlooked risks connected to blood pressure medications in older adults. And it's not the medication's fault. It's just something that happens when blood pressure is being managed and the body needs a little extra help adjusting. Now let's talk about something that is equally important, maybe even more important: the lifestyle habits that work alongside these medications. Because here's the truth: even the best blood pressure medication in the world cannot undo the damage being caused by certain daily habits. I'm not here to lecture you. I'm here to talk to you like a trusted friend who genuinely cares about your health. So let's be real with each other for a moment. Salt, sodium. This is one of the biggest factors in blood pressure, and it's hiding in places you would never expect. It's in your bread, it's in your canned soups, your deli meats, your frozen dinners, your salad dressings, your pickles, even your breakfast cereals. The American Heart Association recommends keeping sodium under a certain level each day, and most Americans, especially seniors who grew up in an era of heavily salted cooking, are consuming far, far more than that. And when you're eating that much sodium, it works against your medication. Your kidneys hold on to extra fluid to balance out all that salt, and that extra fluid puts pressure on your blood vessel walls. Your medication is working hard to bring that pressure down, but the sodium keeps pushing it back up. It's like trying to row a boat upstream while someone else keeps paddling in the opposite direction. Then there's water intake. This might surprise you, but many seniors are mildly dehydrated almost all the time. As we age, our sense of thirst actually decreases. Our bodies don't send us the same strong thirst signals that younger people get. So seniors often don't drink enough water throughout the day without even realizing it. And dehydration can actually make blood pressure behave unpredictably, sometimes causing it to spike, sometimes causing it to drop too low, especially in combination with blood pressure medications. Plain water throughout the day matters more than most people give it credit for. Let's talk about stress. I know, everyone talks about stress, but hear me out, because this is really important for seniors specifically. Chronic stress, the kind that simmers quietly in the background every single day, causes your body to release hormones like cortisol and adrenaline, and those hormones literally squeeze your blood vessels tighter. They make your heart beat faster. They raise your blood pressure. Even if you're taking your medication faithfully every day, chronic stress can be quietly working against it. And what makes this especially hard for many seniors is that stress doesn't always look like what we expect. It's not just big dramatic events. It's the worry about money. It's the loneliness of living alone. It's the grief of losing friends. It's the anxiety about health that keeps you up at night. All of that quiet daily stress has a very real, very measurable effect on your blood pressure. And then there's sleep, or more accurately, the lack of it. Poor sleep and high blood pressure have a relationship that researchers have studied deeply. When you don't sleep well, whether that means waking up too often, or not getting enough hours, or having sleep apnea where your breathing stops and starts during the night, your body spends those dark hours in a state of low-grade stress. Your blood pressure, which is supposed to dip naturally during sleep, stays elevated, and the next morning your body starts the day already stressed and strained. Over time, this wears down your cardiovascular system in ways that even good medication can't fully counteract. This is very important, so I want to say it again clearly. Medication manages blood pressure. But sleep, stress, salt, and hydration are what shape the environment your blood pressure lives in every day. One without the other is never going to be as effective as both together. Now, let's talk about something that I feel is not discussed enough, and it touches on something deeply personal. Many seniors feel embarrassed or confused about asking their doctor questions about their medications. They worry about seeming difficult or taking up too much time, or they just trust that the doctor knows best and don't want to question anything. And while trusting your doctor is absolutely important, being an active participant in your own healthcare is just as important. You have the right to understand what you are putting in your body every single day. You have the right to know what to watch for, what side effects to be aware of, when to call the doctor, and what lifestyle changes might help your medication work better. That is not being difficult. That is being a wise and self-aware person who takes their health seriously. If you've been noticing any of the signs I mentioned earlier, the ankle swelling, the persistent cough, the dizziness when standing, the unusual fatigue, please write those things down and bring them up at your next doctor's visit, or call the office and ask a nurse. These things matter, and you deserve to have them addressed. There's one more thing I want to talk about before we wrap up, and it's something that touches the hearts of so many seniors across this country. Medication routine, consistency. Taking your blood pressure medication at the same time every day is genuinely one of the most important things you can do for your cardiovascular health. Blood pressure medications work by maintaining a steady level in your bloodstream. When you miss a dose or take it at irregular times, that steadiness breaks down. Your blood pressure can bounce around in ways that are hard on your heart and blood vessels. I know that life gets busy. I know that sometimes you forget. And I know that for some seniors, the cost of medications creates very real and very painful decisions. If cost is ever a barrier, and this is something not enough people know, there are patient assistance programs, generic options, and community health resources that can help. Please, please don't silently skip doses because of cost. Talk to your pharmacist, talk to your doctor's office, or even look into programs like Needy Meds or RX Assist, which help connect people with affordable medication options. Because here is the painful truth that I want you to really sit with for a moment. Uncontrolled high blood pressure, when it's ignored, when it's poorly managed, when it's fighting against daily habits that make it worse, is one of the leading contributors to stroke, heart attack, heart failure, and kidney disease in older Americans. These are not just statistics. These are real, life-altering, family-shattering events that happen to real people every single day. Events that, in many cases, could have been significantly reduced with better awareness and better daily habits. I share that not to scare you, but to remind you how much your health matters. How much you matter, not just to yourself, but to the people who love you and depend on you. You've lived a whole lifetime and you deserve to live the rest of it feeling as well and as strong as possible. And that starts with awareness. It starts with understanding what's happening in your body. It starts with the kind of conversation we've been having today. So let me bring it all together for you one more time, in the simplest terms possible. If you're taking Amlodipine, Losartan, or Lisinopril, these medications are your allies. They are doing important work every day, but they work best when you support them with good hydration, a lower sodium diet, regular gentle movement, stress awareness, quality sleep, and consistent daily use. Watch for the warning signs we talked about: ankle swelling, that nagging dry cough, dizziness when standing, and don't brush them aside. Bring them up with your healthcare provider. Be an active voice in your own care. And please, never stop or change your medication on your own without guidance from your doctor. These medications need to be managed carefully, and your doctor is your partner in that. You are not alone in this. Tens of millions of Americans are navigating exactly what you're navigating right now. And the fact that you clicked on this video, that you stayed and watched, that you wanted to learn more, that says everything about the kind of person you are. Someone who cares, someone who's paying attention, someone who wants to do right by their health. Keep going. Keep asking questions. Keep showing up for yourself every single day, because you are worth it. Your heart is worth it. Your life is worth it. If you found this helpful today, please take just a second to like this video, subscribe to the channel, and turn on notifications for more simple health awareness videos every day. We work hard to bring you honest, caring health information that you can actually use in your everyday life. And we would love to have you as part of our community. Thank you so much for being here, and I'll see you in the next one.